Hey guys, we have a federal election coming up on Monday in Canada, but we have not heard a lot on the campaign trail and the debates anywhere from the major parties about what they are going to do about healthcare. Obviously, that's because everyone's focused on tariffs, but healthcare is top of mind for Canadians. So what do we find in the party platforms around healthcare? Let's talk about it. So all the parties are all in on improving access to care, which is the right thing to focus on. Getting people doctors, reducing their wait times for specialist care, for surgery, etc. They all talk about national licensure for doctors to move freely between provinces, which will help with that problem. They also talk about accelerating licensure for doctors from other countries, especially the US, because there are a lot of Canadian doctors, for example, in the US who are looking north right now longingly with what's happening in the US. So it's a good time to try to recruit those doctors back. And by and large, all the parties are talking about increasing medical school capacity, increasing residency spots, so we're training more doctors here in Canada as well. Now let's start with the Liberals. Oops, new guy. So the Liberals are a little bit more concrete about helping primary care. They're talking about a new practice fund where they put some money towards offsetting the cost of opening a new family practice for Canadian doctors just entering into practice. Also $4 billion for new hospitals and new clinics. They also talk about reducing some of that administrative burden on doctors by improving access to some digital technologies. They're not very specific on how they'll do that. They have $20,000 for IVF per couple. And finally, they're going to leave dental care and pharmacare in place as they are. The Conservatives are specifically talking about bringing in 15,000 new doctors from both from training Canadian doctors, but also from other countries, particularly the US. They're talking about automatic licensure for doctors from the US to accelerate that route to come back to Canada. One of the things that's different in their platform is a focus on addictions. They want to ban safe supply. They want to ban safe injection sites. They want mandatory treatment for folks with addictions. Finally, these guys are also all about access, which is great. They talk about every Canadian having a family doctor by 2030. That's 6.5 million people right now who don't have a family doctor. How they're going to get there is less clear, but again, reducing barriers to people coming in from other countries to practice here and improving that access to residency spots right here in Canada. They also have a focus on rural health, making sure people, for example, in the territories have access to healthcare and maybe reducing some of those costs for doctors to set up their lives in those remote areas. They also talk specifically about improving access to mental health services. They will at least maintain dental care and they will expand pharmacare. So they're talking about that initial vision they had with pharmacare, which is coverage of essential medicines within about a year and even more medicines beyond that in the years to follow. So healthcare is a provincial jurisdiction in our country, which is probably why we're not hearing about it as much in the federal election. But the federal government pays for a lot of healthcare and they can have these signature programs like they have had with dental care and pharmacare, so they can make a difference. Think about those different platforms and how it might affect you, and make sure you vote Monday if you haven't already.